my name is Mallory Schramm, and today I will be speaking on the effects of music therapy in the neonatal intensive care unit, also known as the NICU. So for this project, my PICO question states, in the neonates in the neonatal intensive care unit, NICU, what is the effect of music therapy on developmental function, such as sleep, feeding behaviors, and weight gain, when compared with neonates in the NICU receiving standard care by unit protocol within the first 6 months of life? So my population for this project is neonates in the neonatal intensive care unit. My intervention is music therapy. My comparison is neonates in the NICU receiving standard care by unit protocol. My outcome being developmental function such as sleep, feeding behaviors, and weight gain. And lastly, my time being within the first 6 months of life. So it is important to study the interventions that may reduce the risk of long-term effects or disorders in premature infants. Finding effective ways to improve neonatal development is crucial to increasing the quality of life of several patients and their caregivers. When doing a literature review, I chose first to search the Medline with full text or EBSCO database using the keywords of music therapy and preterm infants. I limited my search to articles published within the last 7 years, the main language being English, there being peer-reviewed journals, and the full text being provided. With these keywords and limits on this database, I was able to find 5 articles. Then I moved over to Gale's Academic One file using the same keywords, music therapy and preterm infants, and the same 4 limits, published in the last 7 years, the main language of English, a peer-reviewed journal, and full text provided. There, I was able to find 4 total articles. Lastly, I went over to ProQuest's Nursing and Allied Health Source database, using again the same keywords, music therapy and preterm infants, and the same 4 limits, published within the last 7 years, main language of English, peer-reviewed journals, and the full text provided. Here, I was able to find a total of 20 articles. So for my first article, it covered the effects of music therapy on pain responses induced by blood sampling in premature infants. So this study used 20 infants, and music was played from 5 minutes before until 10 minutes after blood sampling. There, the infants' facial expressions and physiological measures were recorded from 10 minutes before until 10 minutes after sampling. So as far as results, there was a significant difference found in terms of heart rate during needle extraction from the infant's body, as well as a difference in heart rate in the first 5 minutes after sampling. And lastly, there was a significant difference detected in terms of the sleep-wake state in the first 5 minutes after sampling as well. So my second study covered the use of music during physical therapy intervention, which was a randomized controlled trial. This used a total of 26 premature infants who were all prescribed physiotherapy and still inside of an incubator. So these infants underwent physiotherapy for 15 minutes, including vibration and aspiration. A recorder was placed inside the incubator with an intensity of 25 decibels. And lastly, the measurements of heart rate, respiration rate, and oxygen saturation were measured before, during, and after each session. So this resulted that ultimately there is a beneficial effect of music, showing a lower respiratory rate in newborn infants during and after the respiratory procedure. Lastly, my third study covered the efficiency of music therapy in the improvement of neuromotor development in preterm infants. So this was a simple random sample of 36 preterm infants in the NICU. An intervention was given for 30 minutes, 3 times a week for 3 weeks. Interventions showed that a mean group value of infants using the Neurological International Battery Score was a total of 65.11 with a standard deviation of 1.568, and the control group had a mean value of 63.22 with a standard deviation of 2.756. So focusing more on study 1, which again covered the effects of music therapy on pain responses by blood sampling. So for this title, it did fail to clarify that only nurse-initiated strategies were implemented and evaluated. However, the purpose of this study was very clearly stated. The aim of the study was to assess the effect of music therapy on physiological and behavioral pain responses in premature infants after and during blood sampling. So the literature review was covered in the introduction section of this article, primarily focusing on premature infants' stronger sensitivity to pain when compared especially to older infants, and their subjection to frequent painful stimuli in the beginning of their lives, which could possibly lead to long-term effects. So the independent and dependent variables of this study were made clear in the title, with the X variable being music therapy and the Y variable being pain responses. In this clinical crossover study, infants were studied randomly, once as an experimental subject and once as a control, and each infant was considered as its own control in order to eliminate the influence of individual characteristics. So as far as human protection, there were ethical considerations included, such as obtaining permission from relevant authorities, getting written permission from the ethical committee, explaining the objectives of the research, and getting the informed consents of the infant's parents. And lastly, receiving authorization from Dr. Schwartz to play transitions music in the research study. So the tools used in this study included a questionnaire containing demographic information, a form of recording physiological signals, a form of recording sleep-wake state, and the neonatal facial coding system, also known as the NFCS scale. So lastly, as far as data analysis, in order to analyze the findings, considering the effect of the period and the carryover effect for quantitative measurements, and analysis of variance, ANOVA, with a random effect was used. So again, these results showed that significant differences in heart rate during needle extraction and the first 5 minutes after sampling. The statistical difference in the infant's sleep-wake state in the second 5 minutes before sampling was significant as well. And lastly, there was a significant difference in the infant's facial expressions of pain in the first 5 minutes after sampling. The authors were able to find that the time interval between experimental and control groups, the small sample size, and a small variety of music types were limitations to this study. However, it still showed that playing music is an effective intervention which decreases heart rate, sleep-wake state scores, and facial expressions of pain in neonates in the NICU. So on to study 2, which covered the use of music during physical therapy intervention in a NICU. So again, this title fails to clarify that only nurse-initiated strategies were implemented and evaluated. However, once again, the purpose of the study was very clearly stated. It was to compare the effects of music on vital signs of premature infants undergoing respiratory physiotherapy. So as far as literature review, that was covered in the introduction section of the article, stating that previous studies have shown that music therapy is an effective way to improve the clinical status of premature infants. So the independent variable was made fairly clear in the title, stating that the X variable would be music during physical therapy intervention. However, the title failed to clarify that the Y variable would be the vital signs of the premature infant. So again, as far as the research design, this randomized clinical trial consisted of 26 premature infants. And before starting the study, the approval of the ethics committee was acquired, as well as the signing of informed consents by the newborn's parents. As far as data collection and tools, the value of heart rate and respiratory rates, as well as oxygen saturation, was recorded before, during, and after the beginning of the sessions. The measurement of heart rate and oxygen saturation was carried out by a monitoring system, whereas the respiratory rate was monitored for 1 minute by manual stopwatch. So statistical analysis were performed with the analysis of variance for repeated measures, again the ANOVA, and the Bonferroni test was used for multiple comparisons. So this study did show that 30% of the variation in respiratory rate was due to the inclusion of music during and after physiotherapy. However, the authors did find that the lack of research following long-term effects and the lack of analysis of the effect of live music and recorded music were still limitations of this study. That doesn't change the fact that there are still beneficial effects of music, pointing to lower respiratory rate in newborn infants during and after respiratory physiotherapy. So on to study 3, which covered the efficiency of music therapy in the improvement of neuromotor development in preterm infants. This title did fail to clarify that there was only nurse-initiated strategies that were implemented and evaluated. However, the purpose of this study was very clearly stated. It was to determine the effect of music therapy and developmental program on preterm infants in the NICU. So this literature review was covered in the background section of this article, primarily focusing on the statistical data regarding the risk of disabilities in preterm infants. So the independent and dependent variables were both made very clear in the title, with the X variable being music therapy and the Y variable being neuromotor development. So as far as the research design, this was an experimental study using a simple random sample of 36 preterm infants in the NICU. The study was approved by the ethics committee, and written informed consents were obtained after explaining procedures to the infant's parents. Lastly, all infant motor performances were assessed on the first and last day of intervention using the Infant Neurological International Battery scoring and the test of the infant motor performance score. Intervention was given for 30 minutes, 3 times a week, over 3 weeks. As far as statistical analysis, this was done using the GraphPad InStat version 3.06, and statistical significance was set at p less than 0.05. As far as results for this study, there was a marked difference in the score of the INF-ANIB and the TIMPS score, which shows that music therapy and developmental program was effective in the 18 participants of this study. So the authors found that a smaller duration of intervention and a small sample size were limitations of this study. However, it still shows that music therapy can be used to improve the neuromotor development of preterm infants. So in conclusion, the aggregate data from these studies do suggest that providing music therapy to premature infants in the NICU can improve neuromotor development, serve as an effective pain management technique, and improve the efficiency of respiratory physiotherapy treatments. So overall, this can result in significantly lower long-term risks or disorders of premature infants in the NICU. Thank you, and have a good day.